Hi. What do you think about when you see the color green? I think about scoliosis and my own personal experience of scoliosis. I also think about the kids that are in the position that I was once in. According to WebMD, scoliosis seems to be a bone condition, but is actually a neuromuscular condition that is influenced by other factors. This causes a curve in one's spine and can lead to serious health issues if not watched or corrected appropriately. Usually, scoliosis occurs between the ages of 10 and 14. The curve occurs at different points of the spine in each case and can tilt the pelvis or neck. Every curve is different. It is very unique, like one's fingerprint. This is what one's spine might look like. This is my spine before I got it corrected by a spinal fusion surgery. The curve, depending on severity, can cause bad posture, uneven hips and neck, or give the appearance that you are leaning forward. Depending on the severity of the curve, the spine and rib cage may twist. I experienced this with my scoliosis. There are many signs of scoliosis to look out for according to Medicine Net. Uneven eye line, shoulders, and hips can all be symptoms due to the spine's curvature. The head may also seem slightly pushed forward depending on where the curve is located. A test you can do to determine if you may have scoliosis is the Adams Forward Bend test. Doctors often do this at the doctor's office. Oftentimes, they will have their patients bend over as if they are touching their toes. If they see that the rib cage is sticking out more on one side, it is a sign of scoliosis, and they will refer you to a spine doctor to get checkups. If you see that one side of your ribs is sticking out, mainly it'll be your right side, it is also a sign that you may have scoliosis. As of right now, though, scoliosis cannot be treated unless you have spine surgery or a spinal fusion. For patients with a curve of 24 degrees or less, most doctors will recommend regular checkups. Some doctors will place patients in back braces for 23 hours a day, 7 days a week, if the curve is 25 to 39 degrees. According to ScullySmart, bracing does not correct the curve or prevent the curve from worsening. It also weakens the core and back muscles and drastically decreases respiratory functions. Overall, bracing does not do any good. It actually does more harm than it does good. However, new methods are being created to maybe cure scoliosis before having to get the surgery. When a curve reaches 40 degrees, patients are recommended to a spine surgeon. The spine surgeon will then do checkups about every 6 months, and if they see that your curve is continuing to worsen after you are finished growing, or if your curve is more than 50 degrees, they will recommend surgery to correct the curve. Mayo Clinic says that if severe scoliosis goes untreated, however, it can cause many other serious health issues in the future. This includes respiratory and circulatory problems. In my experience, the surgery really helped my functions and also got rid of any pain that I had previously. After my surgery, my spine is at 15 degrees, and a spinal fusion will look like this in an x-ray. I hope this was a very informative speech and taught you a lot about scoliosis and its signs or symptoms and its treatments. I also hope that this encourages you to look more into scoliosis because it is a very common disease, mainly in girls, and more research should be done about it.